Hi, I'm Michael, and today I'm going to be discussing the communications plan for the North American pharmaceutical company Pfizer. Pfizer is among the world's leading biopharmaceutical companies. It develops and produces medicines and vaccines for a wide range of medical reasons, including immunology, oncology, cardiology, and neurology. It was founded in 1849, 171 years ago, in New York City. Its most recognizable medicines produced are Viagra, Lyrica, and Duflican. It's the 49th largest public company, and it has a market capitalization of $210 billion as of August 2020. And it also gained notoriety in November 2020 after announcing that their COVID-19 vaccine was 95% effective and almost ready to be released to the public. The biggest challenge Pfizer faces is the COVID-19 pandemic and their response to it. COVID-19 has infected 63 million people, killed 1.46 million, and is present in over 218 countries across the world. COVID-19 is an infectious disease caused by newly discovered coronaviruses. COVID-19 is mainly transmitted through droplets when an infected person coughs, sneezes, or exhales. You can also be infected by breathing in the virus if you are in close proximity of someone who has it, or if you have touched a surface that person has come into contact with. Pfizer's three biggest competitors are Moderna, BioNTech, and Johnson & Johnson. Since the beginning of the pandemic, the pharmaceutical companies around the world have been vowing for the opportunity to produce the first COVID-19 vaccine for 2021. However, though, Pfizer is in the lead after just being approved in the United Kingdom for a vaccine to be distributed in January of 2021. Canada is not at the back of the line, though, said the co-founder and chairman of Moderna. Moderna's vaccine is currently in its phase 3 trial, and the preliminary data shows that it's 94% effective. This can pose to be a threat for Pfizer in the potential future. Furthermore, stocks have been increasing for BioNTech over the last month, and millions have been invested. This has been an increasing threat for Pfizer. Furthermore, Johnson & Johnson has announced they will produce 1 billion doses of the COVID-19 vaccine by the year 2022. The company also has plenty of experience in launching new drugs and a resume that would help in the event of a global vaccine rollout. The main objectives for Pfizer are motivational and informational. The motivational objective is to safely and efficiently produce enough publicly available vaccine doses to equal the population rates and then begin distribution around the world before January 2021. Pfizer's motivational objective is straightforward, and it strives to meet numbers and dates that are important to the successful producing of a vaccine, such as the deadline for January 2021, and to meet the population rates of the countries that need it the most. We can track the objective by asking how many vaccines will be produced, and then determine the amount of vaccines equal to the populations of the countries they're going to, and then was it released by January 2021. The informational objective is to provide the public of all the countries on the globe with reliable and concrete COVID-19 and vaccination facts through a marketing campaign of 2 years after the vaccine is public. The informational objective is widespread and will rely on corporations and government and other companies all over the world to be clear and advocate for this mission. We can track this objective by asking how many people say they will take the vaccine, how many people say they won't take it, and then also take those same people and poll them and see if there have been any changes in positions. The target audiences for Pfizer go in a particular order. These demographics go in an order based on the people who are most at risk for contracting COVID-19. First, we have elderly people. People over the age of 65 are the most vulnerable and account for over 75% of COVID-19 deaths. Second, we have children. Children are at risk because their immune systems are not developed enough to be able to remove and fight diseases like COVID-19. Third, we have immunocompromised people. These people are at risk because they have heart conditions, respiratory problems, or they could be terminally ill. Frontline workers are next, such as nurses, doctors, police, firefighters, and teachers. They should be given first access to the vaccine because their jobs are considered essential in society. And then fifth, we have skeptics, anti-vaxxers, and conspiracy theorists. They are important because Pfizer has a communications plan to change their opinions and shift public opinion on immunization. Next, we have homeless people. Homeless people should be targeted because they don't have access to information on COVID-19, and they are often considered forgotten in society. People who are not provided housing pose a threat to public safety because they are not able to properly socially distance. This can often create a continuation of the spread. Next, we have low-income communities in areas such as subsidized housing. Also, for the same issue as homelessness, they don't have the ability to socially distance as well, and their buildings are not as ventilated, so the airflow is not as consistent, therefore increasing spread within these communities. Next, we have adult women and men. Basic everyday people who are just living their lives and everyday citizens should be targeted, as well as the general public. So all in all, those are the main people who should be targeted. Here are some of the strategies Pfizer is using to educate the public on immunizations. First, a 3-phase testing procedure will be conducted on candidates, and they will be medically evaluated through an independent medical personnel. This will show transparency and ensure the public the vaccine is safe and tested. Second, they will be partnering with the Canadian government and the COVID-19 app. This partnership will allow people to report anonymously that they have been vaccinated and give Pfizer and the Canadian government data on immunizations. Other alternatives are having health agencies deliver on-demand immunization to patients most at risk of COVID-19. This makes access to the vaccine easier for all demographics. After federal approval of the vaccine, there will be a 2-year campaign conducted by pharmaceutical companies, the medical sector, and the Canadian government in advocacy for Canadians to get vaccinated. The goal for Pfizer is to clearly educate the public about the COVID-19 vaccine through social media and public advertising. The tone of our tactic is to inspire or motivate the audience into using the service or immunization shot from your local health practitioner. We will work to avoid pressuring and harassing people into getting vaccinated, but instead guide them into making the best choice for the public and individual health. An example of an awareness tactic that will resonate with our target audience is social media advertisements on Facebook, Instagram, YouTube, and Twitter. Pfizer will target users who engage with anti-immunization content and then counter it with pro-immunization content on their timelines. The number of social media network users in Canada now stands at around 25.35 million as of 2020. Pfizer will be conducting evaluations of their communication campaign. The first method of evaluation they will be doing is a day after recall. This communication tool incorporates audience compliance and basic surveying in 24-hour timeframes. Participants are asked to view a specific television program or read a particular news story. The next day, they are interviewed to find out which messages they remember. This is effective because it'll expose viewers to Pfizer's pro-immunization content, which benefits awareness and follows up with the viewer, which reinforces them to think back to messages that caught their attention. The second is communication audits. The entirety of an organization should be evaluated annually to make sure that primary and internal objectives are being met. Pfizer understands this and will conduct analysis of all communication activities in formal interviews with employees, middle management, and top executives. Other outlets such as community leaders, media gatekeepers, and distributors will also be checked on. The important point is that the communication of an organization should be analyzed from every possible angle and from top to bottom, and have as much input from as many people as possible. Doing this holds the company accountable. The third evaluation is pilot tests. This approach is quite common in marketing public relations because it limits cost and enables the company to revamp or fine-tune the message for maximum exposure. Before going national with a public relations message, companies often test the message in key copy points in selected cities to learn how the media will accept the message and how the public will react. Pfizer will use the sample city's reaction to innovate public advertising in an influential direction that will change people's views on immunization. Thank you very much for listening to my presentation on the communication strategy that Pfizer will use for the COVID-19 vaccine. Be sure to check out the link that I've sent on how to download the COVID-19 app, which can help track COVID-19 in your areas and prevent the spread. Thank you very much, and have a great day.